discuss the anatomy of the wrist joint. The wrist consists of 8 carpal bones. The proximal row consists of the scaphoid, the lunate, the triquetrum, and the pisiform. The distal row contains the trapezium, the trapezoid, the capitate, and the hamate. These bones have been described in various carpal movement theories as being arranged in 2 rows, columns, or as an oval ring. Let's now move on to the wrist ligaments. The extrinsic ligaments connect the carpus to the forearm bones, the radius and ulna, or to the metacarpals, and are located both dorsally and volarly. The extrinsic volar ligaments are stronger than the dorsal extrinsic ligaments and are important stabilizers for the wrist joint. Volarly, the radioscaphocapitate, or RSC ligament, connects the radial styloid to the scaphoid and travels beneath the waist of the scaphoid to insert into the capitate. This ligament creates a sling to support the scaphoid during wrist motions. Long and short radiolunate, or RL ligaments, also originating at the distal radius, insert into the lunate. Between the long radiolunate and radioscaphocapitate ligaments is the space of Poirier. This is a weak zone overlying the lunate-capitate intersection and can become an area for a potential lunate dislocation, as there are no ligaments that directly attach the lunate to the capitate. Still volar, but now on the ulnar side of the wrist, lie the ulnocapitate, ulnotriquetral, and ulnolunate ligaments. These 3 ligaments connect another highly detailed ligamentous structure at the distal ulna to the carpus, the triangular fibrocartilaginous complex. The arcuate ligament is a broad arch spanning from the radius to the ulna, connecting the radius, scaphoid, and capitate, and then blending into the fibers of the ulnocapitate ligament. Dorsally, there are 2 main ligaments running roughly horizontal. The dorsal intercarpal ligament runs from the triquetrum to the scaphoid, trapezium, and trapezoid, and the dorsal radial-carpal ligament originates from the radius at Lister's tubercle, converging to attach to the lunate and triquetrum. The intrinsic ligaments originate and insert within the carpus, connecting the carpals to each other. In the proximal row, the 2 most important stabilizing ligaments are the scapholunate and lunotriquetral ligaments. Now, let's briefly review the muscular anatomy that surrounds the wrist joint. Extrinsic flexors and extrinsic extensors all influence wrist motion. The flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris all attach to the bases of metacarpals but have no direct connection to the carpals. However, the flexor carpi ulnaris inserts into the pisiform and links to the hamate via the pisohamate ligament. This is the only tendon with any attachment to a carpal bone.